Hello, my wellbeing buddies. It's me, Steve, the mental health nurse, and we're looking at schizophrenia in this session. So, we're going to cover what schizophrenia is, some of the causes of schizophrenia. We'll look at some of the risk factors. We'll look at some of the signs and symptoms, positive and negative. We'll look at how it's assessed. We'll look at some of those natural treatments, and we'll look at some medication options. So, schizophrenia is a chronic and severe mental health disorder, and it affects how a person thinks, feels, and behaves. It is incredibly complex, and it's a very difficult, debilitating condition. It can usually develop in adolescent years and then into early adult, and it affects about 1% of the population. So the symptoms of schizophrenia can be divided into positive symptoms and negative and cognitive symptoms. So positive symptoms here, these are the symptoms that involve distortion of the excess of normal functioning, such as hallucinations, hearing voices, seeing things that are not there. Delusions that are false beliefs and not based on any reality, or distorted thinking and or speech. So they're seen as positive symptoms. The negative symptoms then involve a decrease or loss of normal function, such as a reduction in emotional expression, a lack of motivation or pleasure, and decreased speech output. And that cognitive symptoms, these are symptoms that involve difficulties with thinking, processing information, memory, attention, and decision making. So, what's the cause of these? The cause of schizophrenia are not fully understood, but they are believed to be involved in a kind of a combination of genetics, environmental factors, so upbringing, and biological factors. Treatment for schizophrenia typically involves a combination of medication and therapy, and support from healthcare professionals and support groups as secondary services. The goal of treatment is to manage the symptoms and improve the executive functioning and their functioning, and promote just overall well-being and quality of life with appropriate treatment and support. And many people with schizophrenia are able to find and lead fulfilling and meaningful lives. So, what are the risks associated with this? So clearly genetics play a part, and genetics are always going to be a problem here. So if there's a history of genetics there, that can increase the risk. Brain development as well. So anything to do with the prefrontal cortex, the hippocampus, the parts of the brain that's responsible for emotional and regulation can be slightly altered, meaning you might end up with some behavior that's hazardous or challenging. So an issue there around regulating oneself and gaining control. There is potential issues around malnutrition, self-neglect, and other issues around there. Issues around substance misuse or substance abuse to help self-manage some of these symptoms. Environmental factors means exposure to environmental stressors, such as social isolation or kind of being out on your own there could increase the risk of developing schizophrenia, and or childhood trauma. So we can see childhood trauma playing quite a lot of theme in mental health throughout all of this. So it's important to note that all risks that develop with schizophrenia don't necessarily relate to everyone, but again, are personal centered. So we need to do some history taking and really understand this person. So we've already looked at some of those positives and negatives and cognitive things around some of the symptoms, but equally some of the other symptoms and signs that you see could be around cognitive symptoms, social withdrawing, impaired occupational functioning, emotional imbalance, and disorganized behavior. So how is it assessed? The assessment of schizophrenia is typically involved a comprehensive evaluation, mental health history taking, detailed interview notes, and questionnaires and rating scales. The DSM-5 and the ICD-11 look at other criteria, and this needs to include the presence of 2 or more of the following symptoms. So we're looking at over a month period. Are there hallucinations, speech? Is there disorganized chaos? Is there chaotic behavior? And are there those negative symptoms we talked about earlier above? There's the social and occupational dysfunctioning. So does this affect their ability to maintain themselves in society? Does it affect their work? Does it affect their home life? There's the duration of the symptoms. So the duration of schizophrenia must be present for at least 6 months during at least 1 month of the active symptoms. And then again, there's the exclusion of other disorders. So we need to make sure that actually there aren't other mental health disorders going on here. So it does take a comprehensive evaluation to understand this. So that's how it's assessed. Looking at some of those natural treatments, well, again, there's not necessarily any proven natural treatments to support schizophrenia. However, there's lots to reduce the symptoms, and there's lots of evidence-based treatments to support recovery and promote well-being. And again, you're seeing this as a theme throughout mental health. And that's going to be exercise. Exercise reduces stress, improves mood, and promotes overall health and well-being. We've got nutritional therapy. So looking at a balanced lifestyle, cutting out those stimuli, reducing smoke and reducing alcohol and reducing caffeine. There's mindfulness and meditation, again, helping to manage those spiraling thoughts, reduce the stress and the anxiety, and or there are supplements that can be taken, such as the omega-3 fatty acid, and there may be a benefit of the B6 and B12 vitamins as well. It's important to note that those natural therapies should be used in conjunction with evidence-based treatment for schizophrenia. So other evidence-based therapy are going to be support groups. There could be CBT, DBT, and other support and complementary therapy to help this. And that might be talking therapy, recovery model work, care plan approach stuff, wellness recovery action plans, and things to help with those symptoms. So it might be substance, it might be trauma. So again, watch those videos on substance and trauma. If we look at medication that could potentially be prescribed for schizophrenia, we're looking more at the antipsychotic medication to treat schizophrenia, and they're used to manage positive symptoms. So it helps to manage the hallucinations, and therefore they work by blocking the actions of the dopamine to the brain and reduce the psychotic symptoms. So that experiencing of the voices and seeing things. And that could be things like risperidone or olanzapine. We then look at antidepressants. They can be used in conjunction to treat some of the anxiety and to manage that, or mood stabilizers as well, depending on what is most appropriate. It's important to note that medication should be used again in conjunction with all of the other stuff that we've said above. So what's schizophrenia? Schizophrenia is those positive, negative symptoms of hearing voices, seeing things, altered perception, delusion, and that inability to regulate oneself. The causes, it's a little difficult here, but again, genetics and trauma and things like that could be a cause. Risk factors around self-neglect, poor risk-taking, risk to others around managing oneself, and depending on what those voices are saying, both positive and negative voices, it needs to be considered. And I have worked with lots of people who live with schizophrenia, and a lot of them say the voices are comforting and actually they would be lost without them. And there is a very small proportion of people that sometimes those voices are telling them to do wrong things. And what you need to do is have those direct conversations. You know, don't argue with somebody that their hallucination isn't real. Ask them what they're seeing, get them to talk to you about what they're hearing and what they're being told. So at least you have an idea about what's going on. Signs and symptoms, again, they might start talking to themselves, they might start seeing things, they may tell you, you may have a change in behavior and pattern, that paranoia and self-isolation. How it's assessed through a clinical interview and meeting those and meeting that criteria, we'll do that again, meeting that criteria of the DSM-5 and the ICD-11. So that was the presence of 2 or more of the following symptoms around being chaotic, speech, hallucinations, social dysfunction, the duration, and then obviously excluding any other mental health condition. Natural things to help, we summarize that with exercise, normal lifestyle stuff, mindfulness, routine, vitamins, minerals, and positive reinforcement pieces, and a good crisis plan, safety plan, and wellness recovery plan. And then finally, on that medication, we're looking at antipsychotic, antidepressants, and mood stabilizers. Anyway, that gives you a helicopter tour of schizophrenia. My name's Steve Davis, and I'm the mental health nurse. Thanks for watching.